Ma'am, si Secretary Abalos calls it and we quote, different approach that will work within the framework of the law and with respect for human rights. Often, I don't know, he calls it a different approach, the previous government, with emphasis on law and human rights. I don't know if that's a swipe against the previous government, but what do you think? Is there any difference in the last 4 months of this new administration compared to, for example, the first 4 months of the previous administration?
Well, if we're going to compare administration, clearly this is nothing like the previous one. Kasi in the first 4 months, I think we've seen the first wave, it was one of the deadliest, yung mga vigilante killings, saka yung discovered dead bodies, yung mga may placard. So we haven't seen that so far. But there are deaths. And para sa amin, one is too many. Kasi in fact, there should be no deaths in drug arrest. Kasi arresto ang ginagawa mo. But then on 2 points. First, they call it different, as you already said. Different because you clearly want to differentiate yourself from the previous administration, meaning there was something wrong.
Yeah.
Second, this different approach is actually also kind of similar to previous programs. When I was younger, there was even, I remember this, no? Jail the pusher, save the user. Matagal na to. Kumbaga, there's nothing new to what they're saying. And this barangay-centered program, I think it's just logical. Kasi clearly, you can't do it top-down. Alam naman yung kung sino mang official na pupunta, PIDEA, DDB ba ang bababa sa mismo mga operations, if that's what they're thinking of top-down. Clearly, the operation starts from the barangay. In fact, generally in the criminal justice system, the community has a role. Pero here's one thing that ito na yung iniisip ko na dapat sanang na-involve. They're naming so many organizations, agencies, offices, but not the Department of Health. So I'd like to ask them, perhaps confront them. We haven't seen the paper, actually, that's one. So they haven't given us a document where this new program, Bida Bida, is contained. So it's just statements, it's just press releases so far. So I haven't seen the documentation. Compared to the previous administration, they had command memorandums with that. And then on another level, things can be different from what's on paper than practice. And we've seen that in so many other government practices or programs.
But Attorney, if I may,
Yes.
obviously the context is both in the past, no, relative to the past administration. It's also, the context is also in the future. Diba? Let's wait and see. Let's see the details. Let's see the actual execution. But let me take it just to the present and just at the moment and at face value lang. The values that they're being expressed here, community-based, as you acknowledged, demand reduction, drug user rehabilitation, public health perspective. What's wrong with that?
Well, they named the organizations that they're going to work with. It's a good thing already with the public health, no? Medyo natuturol na nila. But then, where's the DOH? And then, from another point of view, kumbaga, if you look at the problem and use the same lens, so you're going to do that again, barangay, etc. As I've said, medyo paulit-ulit. And of course, this would be platitudes and things that are, well, logical. But then here's also another point that I would want for a revamp or a different style of doing things. Where is the data with regard to why people are using drugs? And this is just as, I think there were several surveys already, pero I can't say really anecdotal or really scientific, pero ang hirap kasi pag survey ka tapos bakit ka gumagamit ng droga. Pero among the reasons were, top reason would be yung energy, because it gives you an energy boost. So it's either economic or it's related to perhaps to studies. So economic kasi taxi driver ka o kaya truck driver and you have to be awake for so long. Estudyante, you want to be awake for so long. Or also on the other hand, because for fun or may opportunity lang, peer pressure. Then there's family, failure of the family to supervise, or perhaps the family is involved, among other things. So we need to really see what's the problem why do people, one, use drugs, and second, why do they get addicted?